My experiences of accessing mental health services. Well, I think I've been quite lucky. I've had a really positive experience of accessing mental health services. I live in an area that has good mental health services comparative to many other areas, and I was able to self-refer. That was really important to me because for years I wanted mental health treatment, and the thought of going and asking a GP to refer me was a barrier. And finding out that I could self-refer here, I could just directly email as well, not having to phone. I could just email the intake team and just say, I think I need an assessment, like, can you help me? And then they got in touch with me very quickly, and did a very quick phone screening, which I found quite anxiety provoking because I'm not very good on the phone, but I understand, that's what they do. And then off the back of that, they got me in again quite quickly, within about 2 weeks, for a face-to-face assessment with a mental health nurse, because it was my first ever contact with mental health services. The outcome of that assessment was that I wasn't going to be able to be treated by the kind of IAPT or I don't know, the short-term kind of that I needed to be stepped up to the more complex psychological services. So I was then passed on for a full assessment to the psychological services, for which I only waited yet another couple of weeks. Then I had a full assessment with a clinical psychologist, who then I had another referral because her decision was that I needed a specialist treatment from a specialist service, as opposed to just general psychological support. So I was then passed on to the specialist personality disorder service in my area. So I then had another assessment. So yeah, a lot of assessments. I had another assessment with them, and that was my intake assessment. And then they told me straight away that they were going to accept me into the service, and that they were going to offer me at least 6 months of DBT, which would involve weekly group plus individual sessions. I ended up having 18 months, which was amazing. They took a needs-based approach, and they start with a 6-month contract, but it's got room for extension if it's needed. And I ended up having 18 months from my local services. The support I got from them was excellent. It was slightly varied in that my individual therapist was very, 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 very good, and I had less good experiences with group therapists, but nothing like terrible in terms of access, apart from that for my group I was sent to a hospital that was quite difficult for me to get to, and I had a lot of trouble with being late for that group, and being late is quite a difficult thing for me, and often it wasn't my fault, it was because of traffic, and that was a bit difficult. But when I requested to be moved to one that I could get to more easily, I was, so it wasn't the end of the world. Yeah, I seemed to walk into the mental health services and get exactly what I needed straight off the bat. But I also know lots and lots and lots and lots of people who have not had the same experience as me. I know mine isn't necessarily the typical experience. I think some of that might be because I have 2 degrees in psychology. I was pretty aware of what my mental health conditions were before. I didn't know all of them, obviously, but the main one I had pretty much figured it out. I've got a close friend who had already been in DBT for a year for the same condition, with slightly, obviously we're all different, but and she and I were so similar that I'd sort of come to the conclusion that I had the same as her. So I sort of walked in and said, I'm pretty sure I've got this. Can you assess me for it? And I think that because I was a very informed patient, that made it easier for me to make sure that because I knew what information they needed to have from me, in order to. So I think I don't know what my experience might have been like if I'd known less about psychology, and I've worked also in mental health services, like organisations and stuff, so I know how they work. And I think if I'd have had less knowledge of the mental health service and not had friends who'd already been through the referral process, things might have been different. But yeah, essentially I didn't have to wait very long, because I went all the way from an initial assessment with a mental health nurse to starting therapy in a highly specialised intensive therapy service and that was between like April and November, so in the same year. So I think that's pretty good, given that I went through about 4 or 5 assessments during that period. But yeah, I think that there was some potential bias in that because of the fact that I was very informed as a patient. Less good has been my experience of psychiatric services who have refused to see me completely, despite the fact that I was being prescribed a mood stabiliser, which I ended up stopping taking because I felt like it was causing me side effects that I didn't want. I didn't know if it was helping me, and I asked for a referral to psychiatric services, and they wouldn't see me, even though I've never been seen by a psychiatrist. So that was pretty bad, I thought, given that I was on some quite heavy psychiatric medications at the time, and then I came off them without medical support, which was not the best idea. But I didn't really know what else to do, because my GP said I just had to keep taking it, and I felt like it was making me worse. So so that wasn't great. I think that the link up, because I think that access to psychiatric services is a bit patchy and not very easy, and I've mostly had to deal with my GP for medication and stuff, and that can be quite difficult because they aren't trained to know when it comes to really complex mental health problems. They're not trained to know what's best, so all they've got is what I tell them, and I don't necessarily know either. So I've asked to be seen by a psychiatrist to talk about my symptoms and medications and so on, and they actually refused the referral and just said I should carry on taking what I was on, which I thought was quite bad given that they hadn't prescribed it in the first place. So I thought that was pretty bad. And I know that other people have had quite bad experiences with accessing mental health services, long waiting times, being bounced around from one place to another, or they've had therapists that they've not had a good fit with, and that's been a really terrible experience for them, but that hasn't been my experience at all. I did find that my ending was quite abrupt. I've been very, very, very lucky in that I'm continuing with my mental health treatment through Mind, and they've offered me another 2 years of support, without which I think I would have really struggled, because my discharge from the NHS happened at a point when I was developing new symptoms. But I also think because part of that happened because my therapist changed jobs at that point in time, and he was moving to work at Mind, and so I chose to go and ask them for support instead. But I think that if I'd have stuck at it with the NHS, they would have given me more support, because different things were emerging. So I'm not really sure how that would have panned out. But essentially, overall, my experiences have been really good, and I've benefited massively, and I couldn't be more grateful for what I've had and what I've been given and the level of support that I've been offered.